All right, a very good morning in case you're just joining us. But if you've been with us since we began the show, you're just in time for the second interview we had lined up for you today as we talk about the country's war against drug and substance abuse. And we are looking at the trends that we are currently observing and how this is informing the measures that have been put in place to really curb this menace that is claiming the lives and also, I would say, the destiny of young people, because most of them are trapped in drug addiction. And something that is happening actually was captured even recently by a special report we did here at Citizen Television. The poly use of drugs, multiple drugs being used at the same time, especially in areas such as Mombasa, Kwale and Kilifi. And I believe it's a problem that could be seeping into other areas of the country. And we are talking about this particular issue and the way forward. And I have with me a panel of two, a lady and a gentleman, just to break this problem down for us, to get the nitty-gritties of how best to approach the trends that we are currently reading. I have in studio this morning Professor John Muteti, the acting CEO of NACADA. Thank you so much for creating time, sir.
Thank you.
And we have also with us Dr. Catherine Siengos. She's a psychiatrist. We also appreciate your time, Dr. And she's also an expert on matters mental health. We just want to understand the impact that this has in, the mental wellness of a human being and the trends that we are currently reading right now in terms of how people are abusing these substances. What is it that, we should be doing to best approach this problem that we are currently facing as a society? And I'd just like to begin this conversation by painting a picture, Prof, to look at in Kenya right now when we are talking about drug and substance abuse, how big a problem is it? And I want us to also zero into the specific problem that we're addressing this particular morning, the multiple use of drugs. I was looking at some interesting numbers released by NACADA on, nationally how we are looking like, and even the coastal region being a problem, that an area that bears the biggest burden. I just want you to paint this picture for us. Should we be concerned?
Thank you. Thank you. Of course, this issue of drug abuse is critical. Mm-hmm. We have seen the problem, especially Kenya. Initially, what used to happen was that Kenya used to be a transit, region. People would just get their drugs wherever, and then they would just use Kenya as a transit, mm-hmm. and sell them elsewhere. Now we've become a market, a destination. So these drugs now are coming to Kenya, and there's a big market which has developed. So it has become a big problem, and this is actually the youth who are taking these drugs in large numbers. So our surveys show that these drugs are being consumed by the youth. The youth as low as 16, 18 years, 20 years, these are the ones who are getting hooked. And that is the most productive segment of our society. So we are finding that it is a problem which might impact, critically a lot to our economy. Mm-hmm. We are looking at it as actually a time bomb. Mm-hmm. Yeah.
All right. And, just before we get to even hear from Daktari, there is this trend that we are observing right now. People are shifting from what is known as the hard drugs, the cocaine, the heroin, and they're actually devising their own version of another drug that they feel would give them, that would make them more, I don't know how to call it.
More high or
more high,
more kick, yeah.
Yes.
Yeah, but you see, they still, those are the synthetic drugs we're talking about.
Yeah.
And they are still drugs. Actually, they are more potent. I would imagine, maybe Dr. may, explain further. But the fact that they are turning away from the natural, and I was discussing with the Dr. a few minutes ago, are not much better. They are still drugs. If you are talking of, for example, cannabis, if it is naturally growing and used, the plant or whatever, or if it is synthetic, it's still as bad as, it's called a drug. But I would imagine even the synthetic drugs are much more potent. They are much more potent because, they mimic the chemical combination or composition of the natural drugs. And as they do that, we don't know the kind of chemicals they add up there. So you see now it becomes a challenge because these are chemicals which are not even regulated. There's no regulation, there's no standard. So it is really a serious problem.
From where you sit, Daktari, what are you reading from even the trends that Professor is sharing with us this morning, the shift towards this particular direction of even using the synthetic drugs? What do you conclude from this?
Actually, the management of drug use or substance use or substance abuse is getting more complicated because, like we are seeing, you find when they come up with the new or the novel psychoactive substances which are manufactured in the lab, even the test we are using to pick. So if I do a drug screen and it is one of those synthetic drugs someone has used, I may not be able to pick them. So you're seeing a clinical picture which you can't really understand. And again, we are seeing now even a mixture where they would mix heroin, for example, together with prescription drugs, together with cannabis, so you find a mixed picture. For example, the other day, a patient checked in and he had in his pockets a substance which looked like tobacco. But on further inquiry, we discovered that it was actually ketamine powder. So such drugs, which ideally ketamine would be for theater or there is a special one for treating depression, but there is also this powder one which is coming in. And you find that when you look at people who are saying they are using heroin, heroin itself has had enough problems all the way from the problems coming because of sharing needles, the problem of it getting out of your system in 4 hours and having to look for it, the addiction where you can't be able to do anything with your life and you spend all your time on the drugs, and of course the economic and social impact of it. So you find somebody who thinks they're using heroin, they end up with taking a substance which contains xylosine, for example, a chemical used to sedate animals when they are being transported or they are being operated on. So you find even veterinary medicines are getting in, they are being mixed, and you're being told this is heroin, but it is a mixture of so many things. And that's, for a doctor like me, it gets more complicated because you think you used heroin, we are detoxifying you or treating you for heroin use, but we are seeing a clinical different picture, which even when we do the lab test, we might not pick it. So it is getting more complicated. Yes.
So you don't know which drug you're dealing with, so you don't even know what sort of treatment will be good for this particular patient. Let's get to understand, like in basic terms, what we mean by the term synthetic drugs, just to explain it in layman's language, and what sort of drugs fall under this category.
Okay, so if in terms of drug abuse, when we talk of synthetic drugs, we are talking about the ones which have been manufactured in the lab, and some are manufactured for use for medical use, like fentanyl, which is an opioid, is manufactured, but it's for use for treatment of pain. But again, it's being abused, and some people are even not making it in the regular expected licensed labs, and they're doing it on the side. So synthetic drugs have been with us even for treating of other disorders, but the challenge is when it comes to substance use, they are making highly potent drugs, like for example cannabis. You get a very high potent one, and when you check in the lab you can't find it. If it's fentanyl, for example, it's not being made for use in the medical setup, it's being manufactured for the illicit use. So synthetic drugs, if we look at opioids, for example, because that is the biggest problem when it comes to drug use. Of course, heroin, what many people know, is semi-synthetic. It's not purely natural. So when you look at the natural opioids like morphine, again, the drugs we use in the methadone clinics to treat urine use, methadone itself is synthetic, but it's manufactured with a name of treating. So you find that even the natural ones can cause a lot of harm. Synthetic ones, if used for the use they were made for, are very helpful, and the doses are known. But now the challenge is when you have these synthetic, which are being manufactured not in the licensed pharmacies and labs, and also now they add other concoction. Like I was reading about the Nairobi flower, which is a concoction of some heroin, some cannabis, some benzodiazepines, some of that medication for sedating animals. And when you look at the person who is intoxicated in it, they are showing pictures of different drugs. Yes.
You know what
and sometimes they think, you see, because of they refer to them as designer drugs, isn't it?
Yes.
Designer drugs?
Yeah.
Yes, they are calling them designer, which seems enticing for the young.
Yes.
Actually, now the chemical, the name we are using is NPS, the novel psychoactive substances, or the new emerging substances. Calling them designer, they have been manufactured, but they are very high potent, and the catch is to make sure that the regulating body doesn't catch up with them. So if a lab, especially in the West where they are very quick with that, they discover this is your combination for your cannabis, they quickly change that. So that when you are monitoring, you think they add this chemical, in the next week they have made a different chemical. Yeah, so the catch is to make sure that it's cannot easily be detected. Yes.
Calling it designer, though, okay, just to make it stylish. But Prof, how did we get here? What she's describing is really concerning, if you ask me. The concoction, and no matter how flowery they may make it look,
I think the drug barons and so on are becoming more innovative. The technology is becoming quite sophisticated. So people are now getting into the labs and they're coming up with the chemical combinations and mimicking these drugs. Maybe heroin now would be difficult even because governments are destroying the fields and everything and so on and so forth. So I think the drug barons have devised ways to innovate and get people, buy these things, So I think that's where the problem is. But I think the international community has come together, and we are really pursuing the problem. We are trying to solve the problem, and I think because of course the global nature, globalization, and everything, something happening in America, in Europe, a new drug, developed there by these barons gets, to us very quickly. In a few months, we have the drug. So it's a global problem, really. It's not a local problem,
Recently, there was this concern about fentanyl and its presence in the country and, the use among the young people. There was some survey you did, an investigation you did, and just to tell us whether it's something we should be concerned about, some of these cases that are presented?
Yeah. We did a study. We did a survey. There were some clips going around with the zombie-like people, who looked like they had taken a drug and they could not even, which had affected their muscles, and they could not move, normally, and that prompted us to carry out some investigations, with other multi-agency, institutions, and the thinking was that it could have been fentanyl. But when we looked through, we found, because fentanyl, Dr. has explained, it's a drug which is, when used well, after a prescription, if it's prescribed, it is a drug which is supposed to be used for whatever purposes, to treat some disorders. But you see now, when that drug is now in the wrong hands, now it is used as an illicit drug, and now that is the challenge. So after we did our survey and investigations, we found that really it is not really fentanyl, because we even went to the government chemists and they did analysis and things like that. And as the Dr. is saying, we find that they mix heroin with many other kinds of drugs. And the reason is that heroin is expensive. And therefore, if the drug barons want to make more profits, they would look for cheaper drugs and they will just dilute the heroin so that they get as much. And sometimes heroin is also scarce because we have really disrupted the networks. Yeah, the supply chain and the networks and so on has been disrupted. That means that they don't get enough, and therefore they would want to get other things to supplement that. Now, there's a drug called Zelazine. Zelazine is actually a vet drug, a veterinary drug. And in our analysis, we found that actually Zelazine is the main drug which is making these people act like the zombie you saw in the
zombie-like character.
Zombie-like, yeah.
Somebody can stand for 2 hours.
Yeah, this Zelazine is a drug which is used to sedate, as a tranquilizer for animals. If you want to treat a horse or a cow, you immobilize it by injecting it with this drug. And you can get it over the counter because it's really not, it's not a scheduled drug. It's not even, you don't even get it through prescription. So you can just walk in and get it. So I think smart people realize that they can use it, and they now mix it with heroin, and that's why you see these people acting like that. And that was the main finding in that survey, so that you could find that was it. And we have shared the findings with the Pharmacy and Poisons Board, with the Veterinary Board as well, because they're the ones who are in charge of regulating veterinary medicine, so that we also make sure that this is a drug which should be scheduled, so that you cannot just walk in and get it.
Right. Yeah, and that leads me to the question I wanted to ask. Both of you can weigh in on this. I mean, how easy is it to access these prescription drugs that are now evidently being abused? And does it mean that as a society we are helpless, that nothing can be done, really?
The truth is, in Kenya, you can easily buy most of these controlled substances. It shouldn't be the case. Of course, the Pharmacy and Poisons Board is in charge and keeps surveying and surveillance to make sure that you don't get sold for a drug without a prescription. And if you go in the good chemist, like around here, you ask for a drug and they'll tell you now that this one you need a prescription. But there are many pharmacies and chemists where you can get anything. And that's worrying, because we've had people getting hooked to drugs like Fentanyl, which need an injection, and this person has gone to the extent of injecting themselves. We have seen people buying tramadol. They think it's just an innocent painkiller, but they don't know that it's in the class of other opioids. Betapine, for example. And you see, when you're selling, you can tell the amount this person is asking for. This person is definitely affected. And the worrying thing is the chemist, the pharmacist, technologist, they know the implications of use of these things, and they keep selling them. So it calls for all of us to interrogate the system. Of course, the pharmacists are not as many as the chemists are. So you can't expect to be having somebody, when you open your chemist, you have somebody from PPB checking on you every day. People need to do the right things. As a patient or as a Kenyan, you should not buy drugs without a prescription. Because even if you think it's a headache, it could be maybe your blood pressure is high. And you might get to use a substance thinking it just treats pain, but you end up getting addicted to it. But the sad thing is, you can easily buy anything in Kenya, even without a prescription, and it calls for more efforts to make sure that that is stopped. Yes.
Prof, how is this, as you add on to that, how is this informing your strategies and your intervention, trends such as this? In as much as we are saying people should do the right thing, but the moment you discover this is the trajectory we are taking, we are no longer in the alcohol use, tobacco use, the changas and the busas, we are actually going a very different direction. And there's something also about e-smoking as well, that you wouldn't even know somebody is smoking next to you. How is this informing how you're dealing with the problem of drug and substance abuse in the country.
Yeah, thank you. Of course, we are, because of the challenges we are facing, we are of course also designing new strategies so that we can. And one of the strategies is that we want to get a system which can give us early warning, an early warning system, so that if a new drug is in the market, an emerging drug, we can easily, find out where it's coming from. We can also find out its nature, and we can easily come up with strategies to arrest the situation. Where's the source? Finding the source. So we are strengthening our surveillance systems so that we can have up-to-date, up-to-time information on these drugs. And what is happening is that with the support of UNODC, with the support of African Union and even European Union and other actors, we are coming up with what we are calling a national drug observatory, where we keep information, current information on the drugs which are there, which are coming up and things like that. And now with that kind of information, we are able to share now with the security forces, security agencies and so on and so forth. And we also are able to collaborate with such institutions like you so that when they get a new drug, they can easily, give us information so that we are in the lookout. So that is for some of the strategies which we are using. And then we pass this information to, institutions like the Pharmacy and Poisons Board, because they are the ones who are supposed to be enforcing some of these restrictions.
When you talk about restrictions, if you're given a chance to advise or weigh in on how best to approach this current problem that we are talking about, how best do you think, even the board would go about it to arrest
this is not an individual institution or agency which can do this. It must be a multi-agency kind of thing. Because, you see, there are people who are supposed to do surveillance. There are others who are supposed to enforce. For example, the Pharmacy and Poisons Board. They are supposed to make sure that drugs which are supposed to be sold with a prescription are really sold with a prescription. But of course, we have rogue, chemists and such a people who would just sell it to anybody because they want profit. So I think the thing is, and of course there must be, because they want to make profits and so on. And sometimes because some of these drugs, because they are prescription drugs, you have to keep a record. How much have you got, how much have you sold, and things like that, which may not be really applied very strictly. Sometimes they even bring them, without following the channels where they do records, and that's also another challenge. So I think the thing is to make sure that the law is followed strictly. If it's prescription drugs, they are given out by people who have gotten the proper prescription, and we do a multi-agency kind of approach where we involve everybody, so that intelligence and everybody, are informed and they act together. Yeah.
Dr. If you look at this problem we are talking about this morning, what would you describe as the driving factors? Why we are here talking about it in the first place? Why does it seem like drug and substance abuse is still a problem even today, despite the measures that have been put in place to curtail it?
Okay, so I would begin by saying people get into substance use because they are trying to meet a certain need. So either they are managing an anxiety, they are managing childhood trauma, they are managing difficulties they are facing in life. But before they know it, it becomes a disease on its own, that they can't survive without the substance. So the key is making sure we take care of our mental health, and we say when you have good mental health, you are able to adjust to stressors, because life will always be full of ups and downs. You are able to reach your potential. So if you are engaged and you are able to earn a living and contribute to the society, even if, I tell young people, even if you haven't found a job you can be paid for, volunteer and give your services to the community. So making sure that you reach your potential, you're able to adjust to stressors, and generally being able to live life. For the clinicians and the doctors and the rehabs we have, I need to urge them that the treatment they used to know of substance use or drug abuse, now you need an extra expertise to be able to detect, yes, this person bought heroin, but the picture we are seeing, it is symptoms of an antipsychotic, symptoms of a sedative, symptoms of an anesthetic agent. So you need, and I see many Kenyans who, when they see someone using substance, they are quickly rushing them to a rehabilitation before a proper evaluation is done. And the proper evaluation involves getting to know what really is this person dealing with. And the emphasis from the health perspective is support, don't punish. So when you find someone struggling with drugs, understand them, what led them to this, support them to get treatment. And now we have over 5 clinics for treating of opioid use. The first one was in Mathari Hospital. We have Ngara, we have several in the coast. And the best thing is to be on treatment, because you see, many people wonder why the methadone clinic, you go get a syrup in the morning and go to work. So that is provided for free. You will go take it and you're able to function. As opposed to the person who is taking heroin and in 4 hours it's out of the system, and this heroin is so expensive, they have to rob, they have to share needles. So it's very complicated, and in the process they get HIV, they get hepatitis. So if you are struggling with substance use, don't quit on your own, because withdrawals sometimes can be so severe they can kill you. So you actually need to go to an accredited medical provider for assessment and for the correct treatment. And we have seen many people with this crisis of heroin being expensive, and so sellers mixing it, peddlers mixing it with other substances. It has driven many people to access treatment, even the methadone clinics, the MAT clinics, because they have discovered whatever they are getting, it's actually making them more sick, and the benefits are not there anymore. So I urge everybody struggling with substance use, please get treatment.
Seek treatment.
And also peer pressure. You see, when you are in a scenario, in a peer pressure, would also make these people use this, because, you know, the company they keep and so on and so forth. The online, the internet, you know, our kids go in there, they look at these things, and some of these drugs are glorified, and, you know, given false information that if you take this drug, this will happen, and so on and so on. You know, such a thing, you know, also make them get into drugs to experiment. And as they experiment, now they get hooked. Of course, Dr. has mentioned a very important thing. You know, when people get addicted, sometimes, you know, we shun them, and that even makes them continue and continue. These people should be treated as because it's a disease. Actually, addiction is a disease. I don't think the right way is to go and punish them, to arrest them and take them to the prisons and so on. I think we should look for ways of making sure that they get treated, and that way, you know, it's going to help a lot.
Punish, support, don't punish. That's what Dr. is saying.
Yes.
But let's also talk about prevention, because NACADA, one of the biggest mandates that you ought to be playing is to ensure that the populace is empowered to know the dangers of these drugs and how best to, mitigate it. What have you done in terms of just creating awareness and talking about these causes and talking about telling communities, you know, how to prepare and how to support somebody who is an addict within the society? Do you do this?
Yeah, we do that. You know, one of our main mandate is what we call public education. And with public education, we go out there, you know, and inform the public the dangers of taking these drugs, the general public, but we also specifically target the youth in schools, the youth out of school, so that we can give them proper information that, you know, when you take these drugs, this is what is likely to happen. We have gone a step further, and now we are coming up with programs to target even the kids in primary schools and secondary schools with what we are calling life skills training. life skills training is a training which is aimed at giving these pupils and students confidence to say no. If somebody is pressurizing you to take these drugs, you know, we give you the courage and
tell you it's cool.
Yeah, you can counter such, you know, because you know you are empowered, you know. So these are the life skills we are talking about, and I think it's a program which we are rolling out in schools in conjunction with the Ministry of Education, and it is working out very well. Then of course we have the positive parenting, where we are also talking to parents and telling them these are the signs you can pick out. If you see your kid has got these signs, then this is what you should be able to do. And also this is the right way to talk to your kids, because parenting, most of the parenting, you know, it's been left to teachers, to people, to schools, and they are not, you know, well equipped really to do parenting. Parents should take their responsibilities and mold their kids. Some go to take these drugs, they smoke in their houses, in their homes. What kind of parenting is that, Shuel? You see?
Yeah, very important.
The house parties,
yes.
And what we do during those house parties, and children are there. Doctor, he has talked about what to observe in your child and some things that can give you a clue as a parent that maybe your son or daughter is abusing drugs. Maybe take us there as part of awareness. What is it that you would be able to identify that would sort of hint that this person could be abusing drugs? And if you do that, if you see somebody close to you with those signs, what do you do?
Okay. Yeah, a very important point on the parenting, because even before you want to start seeing whether your child is using drugs, you need to have bonded with that child. And there are some parenting programs. For example, I've been involved in Nairo Parenting Clinic. The Incredible Years, even if you went online, you'll see is one of the programs which has been shown to aid in prevention of substance use, because it starts right from the preschool age time, where the parent learns how to bond with the child, learns how to play with the child, learns how to communicate with the child, learns how to set limits. So you are bonded with this child and you can set limits. There are consequences when those limits are broken. And so even as they come into adolescent, get exposed to the world there, their self-esteem is built, they have self-control. And of course, they will experiment to see what will happen. And that's why Prof was also talking about peer pressure, that you can, there is that bond. They can easily talk to you about their experiences. And even WHO's as handouts, fact sheets on how to even handle a child you suspect is using a substance, and the first encounter, even things like cigarettes. And like Prof has said, some people stock alcohol in the fridge. So if you have been drinking every evening after work, how do you tell your 7-year-old they can't have a beer and yet it's in the fridge? So those are some of the things, because modeling is part of parenting. So you're going to tell me you cannot drink alcohol, but I've seen you drink and get happy. When your friends come, I see you drinking. So what message are you sending to me? So parenting is very key. You bond with the child, and as they grow, puberty and adolescence and young adult, then you are able to tell change in behavior. So any change in behavior, any change in the speech, any change in their mood should have you have this child evaluated. Even if it ends up not being a substance or a drug of abuse, then it could be a mental health need which can be addressed. Yes, so if you spend time with your child, then you're able to identify when they are changing. But if we are the parents who is going to send your child to a boarding school, even in primary, and wait for them and expect, you do not know who this person is for the last 3 years, the teacher 3 months, the teachers know them better, then, and for me, in my opinion, if I was to be asked, I would say primary school should be day school all through. Yes.
All right, so you need to know your child first.
Yes,
that is
yes.
where it starts, because you can't even notice whether they are changing if you don't know them. So take time to bond with your son or daughter to know when something is actually off. That's when now you can be able to tell whether there could be a problem. It could be drugs, it could be anything anyway. It doesn't necessarily have to be drugs. There's a question that has come in, Prof. You know, we've been talking about the heroin and its shortage and it's high cost and all that. So somebody is asking whether this should be interpreted to mean that we are winning the war, because users of heroin are admitting that its potency is going down, it's becoming easy to get, you know, you cannot get it. How do we interpret this?
Well,
a good thing or a bad thing?
It depends. The heroin, we have a shortage of heroin. Actually, even in our survey, we realized that we found out that heroin, we have a shortage. But our interpretation is that we have disrupted the networks, the traditional networks, you know, which these people are using to bring heroin. Therefore, because of that situation, now they are diluting the heroin. It has become very expensive. Actually, the cost of heroin has doubled. It has been very expensive. So those people who are using the heroin now are resorting to diluting it with other kind of chemicals and drugs. So
that's why I'm asking, is the shortage of heroin a good thing or a bad thing? Like,
well, it depends the way we look at it. Of course, as far as we are concerned, the shortage is a good thing. You know, actually, if anything, we should not have any heroin at all. Yeah. So to us, that shortage is a good thing. And if the cost of heroin could go up to 10, 20 times, the better for us, because that means that people will not afford heroin, and the option would be to go to the medically assisted therapies, you know, which Dr. is talking about, because they're
now resorting to poly use of drugs.
No. You see, what we do is that we should also educate them, because the poly use of drugs is actually very, very dangerous. It results, because these are drugs which you are experimenting with. You just add the heroin you have to other drugs which, you know, might bring, you know, even more severe consequences. So we also, because we have the civil society organizations we work with on the ground, the ones who are in touch with these people who are taking drugs, and we encourage them to talk to these people so that they can come for treatment. We have what we call the MAT clinics. And I think Dr. is far much more vast with those MAT clinics, where people are given methadone. Methadone is a substitute to heroin. Well, it is not really. It is a drug which helps people who are taking heroin wean from heroin, and, you know, over time it is more controlled. So we are saying, if these people can stop taking heroin, then they can easily go to these MAT clinics, and they can be helped. And with that person now can even go to do their job. If they are drivers, they will just come in the morning, take the methadone, and they will go back to work. And, you know, so they become just normal people. And with the time, it is possible to wean them out of all these, and then they go back to society. But also, there is also another issue where you find that there are people who, the peddlers, may also be intentionally, you know, diluting the heroin, so that they can get more profits. So you see, so these are two ways to look at it. But I know for sure, because of the multi-agency approach and the surveillance which we have intensified, the heroin is becoming difficult to get in Kenya.
How is the traffic in terms of those who are coming to seek treatment for this, and also take advantage of this to just encourage somebody who is asking, is this condition, because they say it's a disease, treatable? Yeah?
Yes.
And how is the traffic? Are people coming, or we still have a problem there?
We have many people seeking services for their loved ones. In fact, now we say it's like every other household is affected. You have a family member who is either using alcohol or other substances. So the demand is there. The challenge is the cost. There are times where rehab and treatment facilities get full. It's good that now the teacher scheme, the police scheme, and the civil servant scheme, who are the majority workers, can now be paid for their full treatment for substance use, as opposed to the previous years where they had to pay from out of pocket. So this is a good thing. And I would encourage those who are already struggling with substances, please don't go because the economy is bad, start looking for cheaper options or continue using substances which you know have even been changed, because you're going to land in a hospital and the people you find there, I have no idea what you're dealing with, because you think you're using heroin or cannabis, but it has been mixed with other things. So the best thing is to go for treatment. And people know about the methadone clinic where you have to go every morning to get the medication. We now have buprenorphine as well, which you can be prescribed for, like for a month. You take it at home and you go for your reviews. Of course, that is after correct diagnosis, stabilization. So it's not that you, for treatment of these problems, you have to be going to a clinic every day. There's the option of buprenorphine. And of course, there are other substances. You might be thinking your problem is just substance use, but when we remove the substance, we discover you also have depression, or you have another ADHD, like lack of attention or hyperactivity, which should have been diagnosed when you are a child, but because of our systems, it wasn't picked. So when we remove the substance and we observe you, we discover that there's another condition that needs to be treated. So I encourage, if you have a loved one who is struggling with any substance, whether it's alcohol, whether it's cigarettes, whether it's hard drugs, whether it's cannabis, please take them for treatment. And even the e-cigarettes, young people are thinking they are just vaping, but you find they're also adding all those things. The same things being added to hard drugs and to cannabis are also being added in those vapes. So we need to encourage people. Again, when young people see in the West, marijuana has been legalized, you think it's harmless. Yet we know even out there, you find very many people homeless. You find many people on social support. That is not what we want. So don't just look at the TV and say because it's legalized in this country, it's a good thing. Yes.
And for the e-cigarettes and especially shisha.
And they say that it's less harmful.
No. I don't think it is. I don't think it is, because we also carried out some study. NACADA did some study on shisha, for example, and out of that study, we collaborated with the government chemist, and we realized that quite a big proportion of shisha is laced with heroin and some other drugs. So you think you are just taking shisha, but you find that they are lacing it. Either the customers are asking it to be laced, or the people who are selling it are lacing it so that you can get hooked, so that tomorrow that is where they can get the best shisha. And when we brought out these results, and of course there are people who are saying no, heroin is expensive, why should we lace? No, the fact remains that we have information, we have proof that the shisha which is sold, and that is sold in the upmarket, really, Kilimani, Westlands, and all these other places, is laced with these drugs like heroin. And a lot of young girls, actually, the majority taking shisha. 60%, 65% of the people who are smoking shisha are young girls between the age of 18 and 25. Yeah.
And also to add on to that, there are many times young people have come for treatment and they say, I use cannabis, I only use cannabis, I only smoke, I only vape. But when you do a drug screen, you find methadone, you find heroin, you find all sorts of substances. But this person thought they were just using cannabis.
So they don't even have an idea.
They do not know. And the sellers know that if I put this extra ingredient, then you'll be knowing that my drug is the one which makes you feel better. So you leave Eastlands all the way to go looking for it in Westlands, because the one you took was laced, but they will not tell you it's laced. So we need to be very careful with these things. You think it's just shisha, but they have put all sorts of things. We need to be very careful.
All right. When you talked about treatment, I just want you to expound it a bit. What elements are there under the treatment plan? Because I heard you mention something very important. It's not just about the drug problem that you're dealing with. So what else can somebody expect when they come for these services?
So when you come in because of a substance use, or you get into a hospital and we suspect, because sometimes people have even been admitted to a hospital with a road accident, and they have had fractures, and on day 2 you see them conversing because they have been taking alcohol daily and they have not been able to take alcohol in the hospital. Or you see them, their pupils dilating, they are having withdrawal from heroin, and they are there because of a road accident. So when we suspect that there is substance use, then the first thing is correct diagnosis. What is the substance? So we do a test. Now the problem with the synthetic, what we are calling NPS, or what young people think are called designer, they might not be picked by our regular test kits. So then that calls for a key of a good clinician to see the symptoms are in keeping with this substance and manage that. Then once we have removed the substance now, we have removed the effect of the substance, then we observe the whole person. Do you have any other condition?
Okay.
Could there be a masked depression, anxiety, ADHD? Could you be dealing with a chronic illness, like for example, you are diagnosed to have cancer, and because you have not processed that pain, you start self-medicating. Did it start as peer pressure and then you discover now you're getting addicted? So you look at the whole human being and assess them. And that's why the treatment team is not just a doctor. It will have a psychologist, a nurse, a social worker, an occupational therapist, a physiotherapist, specialties from other areas. For example, if you are treating and we discover your liver as an issue, then I'll call a liver specialist. So the treatment has to be multidisciplinary, and it starts with correct diagnosis. So if you're going to a place where they're not going to make a correct diagnosis, then the treatment will not be correct.
All right.
Yes.
Prof, are you concerned about what they call the commercialization of treatment for addiction? It's a world that people have taken advantage of families' desperation, and what is being done to also...
You see, the treatment we are talking of here, for example, for these substance use disorders, is through rehabs and you know, maybe clinics which are giving out these methadone and things like that. It's very expensive, for example, to treat somebody who is in addiction, and we find that most of these rehabs are privately owned, and they would charge as much as 500,000. You know, the cheapest would really maybe be 100,000 or something like that, and of course the challenge is that the government has not put in place enough rehabs to tackle this challenge, and we are in talks with the county government so that at least each county government can come up with a rehab which can take care of people within that. Yeah, because as far as we speak now, we have only 4 national rehabs, you know, and then maybe about 10, 15, which are run by the county governments, and therefore this is as we are saying that a normal person, you know, will not be able to afford that kind of money. And we are also challenging our scientists. Why can't we come up with homegrown solutions? You know, because of course the doctor will tell you the steps to do all this, you know, will cost money, and it's why can't we come up with the local solutions where we can, you know, treat these people? And it's a challenge to us and our scientists.
Yeah.
You know,
to take it up.
Homegrown solutions, cheaper solutions. Maybe these people can be treated from the community, you know, environment. I don't know how possible that is, but I think we can be able to do something.
All right, something
it's
has
actually
to be done
possible to have community care. The challenge is now the penetration of healthcare workers, but I saw the government is now going to empower more community health workers who can actually make sure, yes, the advantage of being in a rehab facility is to make sure you don't access alcohol. So at home, you go for your outpatient treatment and you come at home, but there's a community health worker who can monitor and make sure that you're not accessing this alcohol. So it can be done. So as we increase more community health workers, that is something, because the most expensive bit is the rehabilitation inpatient 90 days, which even government facilities, the NHIF pays 60,000. That is not enough to feed the patients, to have their therapy, to have their
for the entire
food
treatment period.
for 3 months. So you end up finding that patients have to pay extra, even if you have the regular NHIF national scheme. So it's also a call, even NHIF, as it improves, that they could increase the coverage for that, so that whatever is given, because you know food is expensive. It's not just expensive for me, it's also expensive for the hospital, for the rehab. So if you have money to keep patients for 90 days, as much as some might end up being able to benefit from community, we know some have complications.
Right.
So if your liver has a problem, your pancreas has a problem, your brain has a problem, you will need some admission at some point. So we have to look at that, but ideally, the ones who need admission should be fewer than the ones who can be treated in the community.
All right. Thank you so much, Dr. Catherine Siengo, a psychiatrist, and we're also having this conversation with Professor John Muteti, the acting CEO of NACADA. Thank you for sharing your insights on this very important discussion that we're having this morning, a problem that is affecting almost every family. But we have a choice and we have a responsibility to do the right thing, to support those who are addicted, but also to help in terms of creating awareness and to prevent as many as we can from becoming part of that statistic. Of course, we do this each and every week just to empower you and take you to different spheres of just helping you live a better life, a healthier life every Wednesday. My name is Safina Chengoma. Thank you for creating time, but keep watching Citizen TV. There's still a lot that we have lined up for you.